Hello, everyone, and welcome to my YouTube. I call it YouTube Masterclass for parents and for students actually at crossroads wanting to decide or making that critical decision of why should I become a pharmacist or why should my child become a pharmacist. And this is actually a parent's guide, and it's born out of my own lived experience with most of my friends asking me questions why should their child still study pharmacy? And with all the things going around IT, medicine, engineering, and so everyone is asking why should my child become a pharmacist? My name is George. Originally, I'm a pharmacist here in the United Kingdom. I originally completed a pharmacy degree at the Ahmadu Bello University, Zaria, Nigeria. A few years ago, I graduated 1997, and after graduation, I did a bit of other work experience, internship, and found myself working in the financial sector in Nigeria, and went on to acquire more degrees, acquire more master's degree, came to the United Kingdom, did the overseas student conversion exams for pharmacists, and became a GPHC registered pharmacist in 2009. And since then, I've been practicing as a pharmacist here in the UK, and I'm currently a researcher, a PhD research student at the University of Reading, and also looking at how we can assist our colleagues in community pharmacy in Nigeria, looking at about antimicrobial resistance and antimicrobial stewardship. So this is not a framework. This is just born out of something that I wanted to share with people and to help parents like me who probably at crossroads and wanting to know why should their child become a pharmacist. And because I've worked in these two countries, I finished first as a pharmacist in Nigeria. I worked briefly as a pharmacist in Nigeria, and I've worked ever since I moved over to the United Kingdom as a pharmacist. And so this might be of help to anyone who comes across this video who are deeply concerned or who really want to know about their child's future. And that is that I say with all humility that yes, they are a responsible parent, because every parent should be at the decision making level for their child to choose a particular course or to study at the university if they have to go to the university. And so, one of the most common questions people, my friends, parents ask is if pharmacy is still a good career for their child. And this video is actually not to make comparison with any other profession. I'll just talk about my own lived experience. And most of the things that I've heard is that pharmacy is saturated. Yes, there's no doubt about it. Every year we have people graduating from pharmacy schools. Automation will take over. Pharmacy is not as prestigious as medicine, and is it worth the cost of education? So these are the questions people ask and they want answers, and they're valid concerns, to be honest. I, as a parent, would ask those questions if I wasn't a pharmacist. And so in this video, I will address them systematically. I will address them. This video is made without any filter, so please, I will try as much as possible to kind of put them like in series. So after this one, maybe another one, but I will just encourage you, if you know anyone, and or if you as a parent wish to listen to more of this, please subscribe to the YouTube channel. And that is the only way it can reach out to as many people as possible. So, like I mentioned, my name is George Orishile. I am a pharmacist trained in Nigeria, and I currently practice in the United Kingdom. I have worked across community pharmacy, clinical settings, and also health-focused entrepreneurship, and developed businesses, pharmacy businesses, and I'm also a research student at the University of Reading. So this is not a motivational link. It is just a parent's decision guide. Yeah. And so by the end of my videos, parents or students will clearly understand what pharmacy really is today and what opportunities exist in Nigeria and in the UK, and how pharmacy compares with other popular courses or careers, and whether pharmacy is a wise long-term investment for your child. So we'll move on quickly to the first section. Is pharmacy still worth it? So maybe let me just start simply by saying healthcare is a recession-proof. So what it means is that medicines are not negotiable. Health, they say, is wealth. Health is not negotiable. So no matter what happens to the economy, people will get sick. People will need medicines. Healthcare systems will still depend on medicines experts like us. Pharmacy is no longer, pharmacy is not going to disappear. Pharmacy is not disappearing. It is not going anywhere. And that is why every year you have pharmacists graduating. Pharmacy students are graduating every year from universities across the world. So pharmacy is evolving. Yes, technology is also changing how medicines are being dispensed, no doubt. I see as a critical point in healthcare by elevating pharmacists into roles that require judgment, that require ethics, and they require accountability. So, we all know that machines can count tablets. Machines cannot counsel people. Machines will not counsel a worried patient. Machines will not detect a dangerous drug interaction. Machines will not manage long-term conditions, and machines will not protect public health. So we'll require pharmacists to be in operation, be trained to be able to do all of this. So I will say parents should no longer be asking if pharmacy is dying, if pharmacy is at the lowest ebb, or maybe we shouldn't be talking about that. And I think maybe what we should be looking at is my child prepared to practice modern pharmacy? Perhaps from my own experience, pharmacy found me. I remember back in the day, writing JAMB exams, completing the application. My dad actually wanted me to study medicine. And the reason being that everyone at that time, every parent at that time wanted their child to become a doctor. But I think destiny had a different plan for me. I actually I had opportunity to work in a pharmacy store before I completed those application forms, and it changed my orientation. And one of the critical things that stood out for me was the fact that people had their trust in the pharmacist. People could come in, interact with pharmacists, and you see them walking away smiling. And it also opened my eyes to see, you know, that medicine is actually tools to help people get well. So when I completed my JAMB application form, it was all pharmacy. Three choices, pharmacy. And that, you know, that's settled it. So I do not want to bore you with the rest of the stories. So this second section is actually, what do pharmacists really do? What do pharmacists do? I'm sure most people still think that we just hand out medicines. I've seen that. I've had that before, especially during COVID. This is not just to put this together and just hand it out to me. I don't think that is the way it works. That picture is completely outdated. Today's pharmacists, I will tell you, are medicines experts, medicine safety experts. They make clinical decisions. They are public health professionals, and they are trusted advisor in the community. Sometimes when I get back home from the pharmacy where I practice, I'm able to reflect and just appreciate the number of people that walk into the store wanting to see me on, I won't say hourly basis, I would say session after session basis. Because now in the United Kingdom, in England, we have what is called Pharmacy First, NHS Pharmacy First, whereby we're able to attend to some disease conditions, some minor disease or minor ailment conditions, ranging from sore throat, urinary tract infections, ear infections, sinusitis, did I mention sore throat? Yes, sore throat. And impetigo and shingles. So 7. So if you live in England and your child or you yourself or you know anyone who experienced any of this, you can actually walk into a pharmacy without going to make appointments. Appointments these days are very, very expensive. In pharmacies, it is cheap. Come to us and we'll be able to help. So, pharmacists today, we review medicines for chronic conditions like diabetes, hypertension. We provide vaccinations and public health services, travel vaccines, malaria treatment. We prevent medication errors that could lead to death or cost lives. We also work in hospitals alongside doctors, nurses, and other healthcare professionals. We support GP practices as clinical pharmacists, and I can tell you for a fact that in the UK now, if your child is studying pharmacy now, by the time they are graduating, they'll be coming out as clinical pharmacists, so which is a plus to the pharmacy profession. We also work in pharmaceutical companies, and I can tell you that pharmacies are owning business and they manage healthcare businesses as well. I have managed in the time past, but I'm a pharmacist now. I only do the pharmacy bill, which is a clinical governance, and attend to all the services. And this is due to the fact that I have other commitments, my own personal development as a PhD research student. So the pharmacy degree no longer locks a child into one role. Maybe I should just mention this as well. When I graduated as a pharmacist in Nigeria, I actually was one of the few lucky people who was able to work in the banking sector. So after completing pharmacy, I worked briefly um, with a company where they were distributing medicines in Nigeria. So I was kind of like a med rep, and I didn't particularly like it. And I started looking for job opportunities that could take me, you know, further. And yeah, I sat for exams with Arthur Anderson at that time, and I got employed by one of the financial institutions. So pharmacy is kind of flexible. The flexibility in pharmacy is different. It's just it's holistic. It's not as in other courses. So pharmacy and other careers. So parents often also compare pharmacy with medicine, with nursing, with engineering, IT courses, other professional courses. That is very fine. But let us be practical. Medicine is noble. Yes, like I mentioned, my dad wanted me to become a medical doctor. He wanted me to study medicine, but I didn't like it. Medicine is noble, but it takes longer to qualify. The training is more demanding. Work-life balance is often poor. I can tell that. I can say that. Nursing is essential, no doubt about it. Career progression can be limited. Entrepreneurship options are fewer. Engineering is equally valuable, but job security depends heavily on the economy. So pharmacy sits at a unique intersection. Pharmacy sits in healthcare. Pharmacy is a science. Pharmacy is a business. And pharmacy commands public trust. It offers faster professional independence than medicine. Pharmacy is more flexible than many other healthcare roles. Pharmacy offers strong global mobility, and pharmacy offers ethical responsibility, ethical entrepreneurship opportunities. So, for many families, pharmacy offers balance. There's no burnout in it. It offers more balance than any other profession you can think of. So let's quickly go to pharmacy careers in Nigeria and in the UK. And yeah, so maybe geographically, because parents think globally now. Um, like I said at the beginning of the video, I do not have information about how pharmacy operates in Australia or Canada or in the US, but I can talk about Nigeria and I can talk about the UK. In Nigeria, pharmacy offers pathways into community pharmacy practice, which we know as a retail pharmacy. Pharmacy offers pathway into hospital pharmacy. People can work in federal hospitals, state-owned hospitals, or maybe private practice. Pharmacy also offers pathways into importation and distribution of medicines. Pharmacists are now working in regulation and public health. Pharmacists work in NGOs and international health programs, academia and research, healthcare business ownership as well. A pharmacist in Nigeria can be clinically relevant, they can be economically stable, and they can also become an employer, not just an employee. In the United Kingdom, pharmacy offers NHS and community pharmacy roles, hospital and specialist clinical practice, GP practice integration, independent prescribing, pharmaceutical industry careers, leadership, and consultancy roles. So, one pharmacy degree can take you around the globe. So, imagine if you're a pharmacist in Nigeria and you come to the UK to do your conversion exams, you can actually fit into any of these roles once you qualify, once you come onto the GPHC register. So it's just one qualification and that can evolve you. So for example, I'll take myself as an example. My pharmacy degree, I did that. I did an MBA. I also did health economics. I did masters in clinical pharmacy practice, and currently now I'm a pharmacy PhD research student in pharmacy. So it's only a few professions that can offer you this level of flexibility and global relevance. So maybe we should talk about the financial reality parents care about, which is the bits, what is the need for my child? I've invested heavily on this child. What is the returns on investment? But let me be honest. Pharmacy is not a get rich quick career. No, it is not. But what I can tell you is that pharmacy brings a secured income. So it is a secure income career. It is scalable. Like I told you, I did pharmacy, MBA. I also forgot I did health economics as well. So it is a scalable career. You can become whatever you want to become. I have friends who did pharmacy and they went into IT. I have friends who did pharmacy and they stepped up and became, they went into so many other things, medicine, IT, but the bedrock was still pharmacy. The foundation was still pharmacy. And so, it affords you that opportunity. He's a pharmacist. He has knowledge about medicine and he's also a medical practitioner or he's an IT. So it offers, different levels of flexibilities. And it's also a career that supports multiple income streams. So imagine if you're a pharmacist and you also stepped up to do IT certification. So whilst you're doing your pharmacy career, probably 9 to 5, Monday to Wednesday, you're also maybe a data analyst or maybe a cybersecurity expert over the weekend. But you cannot be an IT and practice as a pharmacist, if you understand what I mean. So those are the flexibilities that pharmacy would offer your child if you want your child to study pharmacy. So all in all, pharmacists can combine employment, they can do locum work, they can own businesses, they can go into consulting, they also can go into education, academia, and they also can go into research, which is what I'm doing at the moment. So it is a career that rewards patience. It's a career that rewards patience, discipline, and professionalism. So for parents thinking long term, pharmacy offers predictable stability, but not financial gambling. And what does pharmacy build into your child? Beyond money and titles, pharmacy builds character. Yeah. Pharmacy trains your child to become responsible. Pharmacy trains your child to pay attention to detail. Their critical thinking is top notch. Pharmacy trains your child to make ethical decisions. Pharmacy trains your child to be able to communicate with empathy. And pharmacy trains your child to handle pressure calmly because it's a profession that offers your child that resilience, being able to absorb people's problem and being able to offer solutions to them. A pharmacist understands that one mistake can cost a life, and that mindset shapes maturity. Unfortunately, many parents underestimate how valuable this is. We're too focused on the money. But no, let your child be trained in a profession that builds character, in a profession that makes them responsible, in a profession that makes them pay attention to details, in a profession that makes them think and make ethical decisions, communicate with empathy, and they are able to handle pressure very well, effectively. So, my personal journey, maybe I should use this before we close. Maybe I should talk about this. So, I think I mentioned it before. I chose pharmacy because I saw the impact at an early age. I saw how pharmacists help people directly. I saw trust built across communities. And I also saw how the profession allowed growth beyond the dispensary walls. And my journey as a pharmacist took me from Nigeria into advanced practice into the UK, into education, into leadership, and into entrepreneurship. Pharmacy never limited me. Pharmacy does not limit people. It has expanded me. It has given me opportunities to think beyond the status quo. And that is why I speak to you today as parents, not from theory, but from my own lived experience. So, to all parents listening or watching this, or if you come across this video wherever you are, pharmacy may not be the loudest when it comes to career. It may not trend even on social media, but it lasts, it evolves, and it sustains families. So if your child likes science, if your child enjoys helping people, if your child thinks critically, if your child values stability and growth, then pharmacy deserves some consideration. So, thank you for listening. If this has helped you, please subscribe to this video. Subscribe to my YouTube channel. There are still more to come. But, I mean, this is just like an overview of everything. And I hope that you'll be able to share this with other parents and also join in the conversation. In closing, your child fully deserves clarity, not confusion. And I hope you'll be able to make that critical decision on behalf of your child. Thank you very much. If this video has helped you, please subscribe to my YouTube channel. Thank you. Bye-bye.